Video games are a ubiquitous form of entertainment in today's children and youth, and while fun and exciting, have a darker side that parents and teachers and health professionals can no longer ignore. Playing violent video games is different from playing positive, constructive games. In fact, violent video games may have an even more powerful influence than violent television and movies, whose risks have been documented for decades. While violent video games may promote some complex problem-solving and coordination skills, as well, they may also have multiple negative effects. In violent video game play, the player learns to associate violence with pleasure, rewards for hurting another character. This may undermine moral sensitivity. Under normal conditions, human emotional wiring is designed to abhor violence and feel rewarded for helping others. Those who play violent video games may build opposite intuitions. Many of the most popular games emphasize negative themes and promote the killing of people or animals, the use and abuse of drugs and alcohol, criminal behavior, disrespect for authority and the law, sexual exploitation and violence towards women, racial, sexual, and gender stereotypes, and also foul language and obscene gestures. Store-bought video games are evaluated by Electronic Software Ratings Board and rated for their appropriateness for children and teens. The ratings are featured prominently on the game. When evaluating the impact of video games on children, three parameters are important to consider: duration, content, and age of first exposure. Children who start gaming later in childhood and who stay under the expert guidelines for duration and content will likely demonstrate less negative effects from gaming, whereas children who start gaming young in life, play video games for long periods of time, and who play predominantly mature content with sexual and physical violence will likely exhibit a greater number of negative effects. Mental illness such as addiction, depression, anxiety, and suicide risks can come from playing violent video games. Video games are highly immersive and are persuasively and immorally designed by psychologists for the sole purpose of making users addicted. Use of intermittent rewards are common, and team aspect of gaming both contribute to long periods of continuous play. Anxiety and depression are consistent with gaming, and suicide risk and attempts when gaming becomes addictive. Following 24-hour Survivor Unplugged challenge, where students are tasked with a mission to go 24 hours without the use of any screens, the next morning, in follow-up Tech Talk classroom sessions, gamers who stopped using video games for 24 hours reported that they felt happier, slept better, and fought less with their parents and siblings. Reports of going outside to play were frequent, as were acting out video games outside with props such as tree branches as swords and garbage can lids as shields. When children are gaming, their bodies are still and their brains are overstimulated. Developing bodies crave movement, yet video games entrance and hypnotize the brain into sitting still, often for very long periods of time. Sedentary bodies display physical development also while overstimulating the heart, causing serious and often irreversible physical impairments. Psychiatrist Dr. Victoria Dunkley, author of Reset Your Child's Brain, reports that when children play video games, their sympathetic nervous system goes into a hyper-aroused state of fight or flight, characterized by adrenaline release from adrenal glands and dopamine production in the brain. Sustained high blood pressure and increased heart rate from prolonged gaming increased risk of heart attack and stroke in later years. There are many other negative side effects that can come from playing video games for long periods of time. These things include lower grades, less reading, less exercise and becoming overweight, decreased sleep and poor quality sleep, aggressive thoughts and behaviors. We've all seen children acting like characters recently viewed in cartoons, movies, or video games. While these actions could be considered normal and part of pretend play in early years, what is abnormal is when the child dissociates and becomes non-responsive to interactions with parents, teachers, and other children. Early immersions in violent virtual content can create a condition termed gamer brain, when it appears as if a child has been consumed by gaming content. Another term appropriate for researchers is game transfer phenomena, where the child exhibits visual, auditory, or body perceptions where they see, hear, and or feel the imagery of the video games. When asked if they are in the game, now children will respond stating that they are seeing and more likely to act out aggressively and or violently. The American Academy of Child and Adolescent Psychiatry recommend tips for parents that can help their children enjoy these video games appropriately and avoid problems by avoiding video games in preschool-age children, checking the ESRB ratings to select appropriate games, both in content and level of development, playing video games with their children to share the experience and discuss the game's content, setting clear rules about gaming content and playing time, both inside and outside the home, monitoring online interactions and warning children about potential dangers of internet contacts while playing video games online, allowing video game playing only in public areas of the home, not in the child's bedroom, remembering that you are a role model for your children, including which video games you play and how long you play them, enforcing total screen time limits, ensuring video games are only played after homework and chores are done, encouraging participation in other activities, particular physical activities. These are all very important things to remember when picking video games for your children. So in conclusion, we feel that video games have a very negative effect on a child's learning and do cause violence, and they should be banned or at least more strictly regulated.